Jesse, do you hear that? I think my heart is stopping. I see a white light. Tell my mother I love her lasagna.
Oh, Jabon, relax, please. That is not a heart monitor. That is the microwave timer. Your popcorn is ready.
Oh, are you sure? Because my thumb really hurts. I got a paper cut opening the envelope. It feels fatal.
You are impossible. Ladies and gentlemen, welcome back to English Faster. I am Jessie.
And I am Jabon, the man who is clearly suffering from a life-threatening paper cut.
Today we have a very special and slightly scary episode. We are talking about medical English, specifically how to talk to a doctor without freaking out like Jabon just did.
It is a serious topic. Going to the doctor is terrifying. The smell of the clinic, the white coats, the needles, and worst of all, trying to explain your pain in English.
Exactly. When you are sick, your brain feels foggy. You forget words. You want to say, I have a stomach ache, but you end up saying, my tummy is angry.
Hey, angry tummy makes sense to me. But stay with us, guys. Today, we have funny stories, real role plays, and the exact phrases you need to survive a hospital visit. Let's get started.
Before we learn the grammar, Jibon, be honest. When was the last time you embarrassed yourself at a doctor's office?
Don't ask. Okay, fine. Last year, I woke up with a pain in my chest. Instead of going to the doctor, I asked Dr. Google.
Groans. Mistake number 1. Never ask Dr. Google.
I know that now. The internet told me I had a rare tropical virus found only in the Amazon jungle. I was convinced. I ran to the clinic, burst through the doors, and shouted, "Help me! I have jungle fever!"
No way. You screamed that?
I did. The nurse looked at me, checked my temperature, and asked, "Sir, what did you eat for dinner?" I told her, 5 extra spicy chili burgers.
Let me guess. It wasn't a virus?
Nope. It was gas. Massive indigestion. The doctor gave me an antacid and told me to stop eating like a dinosaur. It was humiliating.
That is a classic story, but it teaches us something important. There is a difference between a symptom and a diagnosis.
Right. My pain was the symptom. The gas was the diagnosis. And the pill was the prescription.
Listeners, to avoid Jibon's mistake, you need to be specific about pain. Ouch is not enough.
So how do I describe it?
Here are 3 key types of pain. 1. Sharp pain, like a knife or needle, sudden and intense. 2. Dull ache, a heavy, constant pain, like a toothache or back pain after sitting too long. 3. Throbbing pain. This is the worst. It beats like a heart. Boom, boom, boom.
Oh, I hate throbbing pain. That happens when I hit my thumb with a hammer.
Exactly. Now, let's put this into practice. We are going to do a role play.
Okay, I'm ready. I will be the patient, because I am good at complaining. You be the professional doctor.
Good morning, Jibon. I haven't seen you in a while. What brings you in today?
Hi, doctor. Yeah, I've been feeling really under the weather for the last 3 days.
I'm sorry to hear that. Can you describe your symptoms?
Well, I have a splitting headache. My nose is running and my whole body aches. I feel like a truck hit me.
Have you been running a fever?
I think so. I feel hot and cold at the same time. I'm shivering.
Okay, let me check your throat. Open wide and say ah.
Uh, ahem. Sorry, Doc.
That's okay. It looks like a viral infection, probably just the seasonal flu. I'm going to prescribe you some medicine to lower the fever. You need plenty of rest and fluids.
Do I need a shot? Please say no. I hate needles.
No injection today, just sleep.
Best advice ever. Thanks, doctor.
Excellent acting. Listeners, did you catch the phrase under the weather? It's a great idiom. It doesn't mean you are standing under a cloud. It means you feel sick or low energy.
And running a fever. Remember, in English, we don't say, I am walking a fever. We say, I am running a fever.
Okay, that was the flu. But what if I fall down? Or what if I trip over my cat?
Then we are dealing with an injury. Let's do a quick scene. You hurt your ankle.
Got it. I am in agony. Action!
All right, let me take a look. Which ankle is it?
The left one. It hurts so much when I put weight on it.
I see. It looks very swollen.
Is it bad?
Well, looking at this image of a swollen ankle, you can see the puffiness here, and it is starting to get bruised. See the purple color?
Is it broken? Please tell me it's not broken.
We need to rule out a fracture. I'm going to order an X-ray just to be safe.
Two big words there. Swollen, big, puffy, and bruised, purple skin.
And the phrase, rule out. Doctors use this all the time. It means to check and make sure it is not a specific problem.
Jesse, can I ask a serious question now?
Of course.
Sometimes doctors talk really fast. They use big words like gastroenteritis or hypertension. I get scared to ask them to repeat. I just nod and pretend I understand.
Jaban, never do that. That is dangerous. If you don't understand the medicine instructions, you could get hurt.
So, what should I say?
Use the magic sentence. Doctor, could you explain that in simple terms? Or even better, could you write that down for me?
Could you write that down? That is gold. Because then I can take the paper home and translate it slowly.
Exactly. Doctors want to help you. Be brave enough to ask.
Okay, before we finish, let's do a rapid-fire round. I will say a bad English sentence students use, and you fix it. Ready?
I was born ready. Go.
Student says, Doctor, I am painting.
Wrong. Never say I am paining. Say I am in pain or it hurts.
Student says, I cut my hairs.
Funny but wrong, unless you cut them one by one. Say I got a haircut, though you don't usually see a doctor for that.
Student says, my body is paining.
Say my body aches. Ache is a better word for full body pain. Well, that brings us to the end of the episode. Jaban, how is your paper cut?
You know what? I think I will survive. I feel much better now that I know the vocabulary.
Good. To our listeners, going to the doctor is stressful, but you can do it. Practice these role plays in front of a mirror.
And remember, If you don't know the word, just point to the body part and say, ouch. It works every time.
Or just listen to English Faster. Thank you for tuning in.
Stay healthy, everyone. Bye-bye.